Welcome, everyone. I have a distinct pleasure of having Dr. Juginder Luthra. He
My
is
pleasure.
a wonderful ophthalmologist and actually is a senior ophthalmologist, and he's actually practicing even at the age of 80 and very active in number of areas in his life. And anybody who enters the ninth decade of life, you know how that is. That's a very unusual situation with his health and wellness, and that you can see him smiling away. But during life, there's always some challenges and stresses, and they come along anyway. So, Dr. Luthra is going to share with us some nuggets or some experiences that he has had during all his illustrious career and life. Over to
Well,
you.
thank you very much for having me on your show. It's such a pleasure to be your guest and discuss something that I normally don't talk about because we just have issues, we deal with them, move on, and so on. But then when you have to stop and think, then topic that we picked for today's talk was stress, how you deal with it, how you have dealt with it, and have I grown with time as to how I dealt with it. I was, when you're young, when I was young and hot and blood and so on and so forth, and lack of knowledge, trainings, the response to the situation was different than it is now. I have found that some stress is very helpful in life because it helps me prepare. I'm a surgeon, so I have to wake up early and be in the operating room at 7 a.m. So therefore, you have to make sure that you sleep in time, you wake up early hours, and not be late because the people are waiting in line there to have surgeries done, and there are many other people attached with those actions. So to be on time, then you have to get ready on time and so on, and keep in mind the traffic and everything else, because all those things cause the delay, and then they add up stress to it. And second thing I found was that if you have a little bit of a stress, it is good for you because then that means you care. If you care, then you will make sure that everything that you plan to do for the day is in order, all the charts are in place, and there is least likelihood of having any kind of a mistake. So it helps you prepare for those situations better, and that's the short term. As you know already, the stress can be of two kinds. It can be a short-term stress, it can be a long-term stress. So as long as it is manageable short-term stress, that is good. But if one is carrying a long-term stress, because stress induces some chemicals that come into the body, acute stress will liberate adrenaline. And adrenaline, then it creates a flight and fight response, and pulse rate goes up, and blood pressure goes up, chances of having a cardiac event increases, chances of having a stroke increases. So those things are the harmful aspects of the stress one needs to be aware, and therefore then prevent. Long-term stress causes release of steroids into the body. And the steroids themselves then can create side effects such as diabetes, high blood pressure, coronary artery disease, depression, and so on. So one needs to be aware as to what situations create stress for me. What creates stress for me may not necessarily create stress for somebody else. So I have to know my body, my mind, and find out situations. And I found that one of the things that was very helpful was to distinguish between prevention and management of stress. And prevention is ideally the best. If I know that a certain situation is going to give me stress and it is something I can avoid, then I would avoid that situation. Like sher ke pinjare mein, if I had to put my hand into a lion's cage, then I would not do it.
Interesting observation. I think one of the things that you're alluding to is preventing, and preventing means you are aware of certain things and prepare yourself. You mentioned a little bit about sleeping early, and all that also is something that you're really preparing for whatever is to come. So being prepared ahead of time
Yes.
helps you.
Also, if I'm going to perform cataract surgery, then it behooves upon me to learn the cataract surgery the best possible way it can be learned. So that way you can perform better for the patient and for yourself. And if you don't know half the steps, then obviously it will be in a messy situation for the patient, and it will be stressful for the surgeon. And whenever it comes to the prevention of these situations, then one needs to become aware, which comes with time and experience, obviously. There are certain people that may create stress in your life.
I see.
By negativity, by some people are critical of others. I will not be a judge on them as to what they are, but for my own protection, I need to be aware that these situations, these people are toxic to me. They may be wonderful in their other environments, but for me, then I need to be aware and then try not to be with them, around them, and that helps. So that helps in the way of prevention. The stress itself can be triggered with not, when we say stress, now we are dealing into the uncontrollable stuff, which is not manageable by the body without causing side effects. So the uncontrollable stress can come from multiple sources. It can come from work, it can come from relationships, from home, from children, from financial situations, and things out of our control. Like my father, I was only 3 years old when the partition happened. We were on the wrong side of India. Little 3 years old did not know what the parents were going through, but I can tell you from looking at their example later on in life, they managed it by just living in the moment. They did what needed done at that time. And I never heard them complain even once. Oh, we had such a big house, that we had so much money, we had this, we had that, and our house of the place of where we lived for generations suddenly is gone. That complaint was never there. And secondly, we never heard them complain about the British or the Muslims or anything else that created a situation for them which they did not create. They just dealt with it and tried to do the best they could do under the circumstances that they were put in.
These are very fascinating points here, and not many people have undergone the stresses you're describing. And in our day-to-day life, though, there is this type of things don't happen very frequently, but they serve as an excellent example of how we can handle stress by not really delving into past or whatever has happened to you, and accept the way things go and living in the moment is what you're referring to here.
Yeah,
So
that's
I think this is very, very interesting, because stresses can leave person with a scar and wounds that are difficult to heal. And if you're able to adjust that in the present moment, these wounds are not necessarily that difficult to manage. And so I think that's something that you're illustrating very well here. Thank you.
Living a mindful life in the moment, it helps that, I don't know if anyone who does not have regrets, one or more or less or bigger quantity-wise. But at some point, one needs to learn to forgive others, needs to learn how to forgive yourself. Learn from that lesson and move on and try to be a better person today because otherwise you can beat yourself to death. And whatever little bit good that we have, it get masked by the overbeating of yourself over the regrets of the past.
Well, these are very fantastic points because what you're bringing up is something that you're shielding yourself away from these active fire. You don't go near the fire, as you already alluded to. Avoid the fire, avoid the situation, avoid the people that are, difficult to deal with, etc. They're causing you. That's you prevent that. So you don't create the fire, don't go near the fire, and shield yourself from
Yes.
these effects that are happening, and continue your own sanity and serenity, whatever way you want to put it. Excellent points here, sir.
Yeah. Also, during life, when you practice medicine, uh, situations like malpractice, fear of malpractice,
Fear, yeah.
was pretty high at certain point in our life. And we used to, socially, we would talk about it. The malpractice premiums were going up. And there were even lessons or lectures that we attended where the teachers were teaching us that whenever you enter a room, you have to look at the patient as an enemy who will kill you.
Wow.
And therefore, you have to cover all the tracks. You make sure you don't miss any commas or dots and so on. And that itself was generating stress because now I enter a room and looking at an enemy. And that was not helpful.
Right.
Till this change occurred where I started looking at myself as an instrument of God.
Wonderful.
Who is out there going into the room,
right,
to treat a patient who that patient is a manifestation of God.
Right.
So in one form of God is meeting the other form of God. One is able to help as an instrument, the other one needs your help as a needy. So therefore, now your whole attitude changes. You do not do unnecessary testings on them. You don't do unnecessary procedures on them. And you don't let your ego come in the way that, sorry, I am not as good at this particular procedure as XYZ doctor is. So let me refer you to that person.
Excellent.
So that ego and the greed goes out of the way.
This is such a fantastic lesson for everyone, and I think that what you're describing here is the mental shift, thinking shift.
Yes.
Describing an attitude shift, a heart shift in terms of developing compassion and inequality of somebody, the God looking the other person like God, and carrying that compassion of healing, that you really want to heal the person and help the person. And that takes away the fear that is there behind. Fear is always there, but the fear is helped by the compassion, by the faith in what you are doing, with a very open-heartedness and to the best of your ability.
Yeah, there are studies, and you probably being a physician, you know yourself, that a physician or a surgeon who genuinely feels the pain of the patient, patient do not sue them. Even though they know the doctor did it wrong, but they will forgive you. You're human, doc, it's okay. And that kind of feelings we have experienced in life.
Right.
The other thing that, sorry.
Go ahead.
No, other thing that I have applied in my professional career was not all these things that they were like enlightenment from within. This was about talking to wise people, putting out your problems to them as seeking solutions and so on, then applying them to your life. Right. So the other lesson that I received from a very esteemed teacher of mine many, many years ago, and I had applied it, I still do, not just in the medical malpractice, but in pretty much every situation of life. That he told me that now you're going to go out in the field. When you look at an eye, just look at the eye, not at their wallet.
Interesting. Very nice. I think these are some of the very nice learning lessons here, and how to keep yourself focused onto who you are professionally, who you are at heart, and what's the purpose of you being there as a professional in this case. And even to non-professionals, the same thing is true if you're in a job. Same thing is true if you're working independently, having any type of business or whatever. To keep yourself away and getting too much entangled with the various aspects of that go along with financial considerations and business, etc. But to provide, for example, you provide a customer to get the best possible customer service that's possible because that's who you are. And once you give yourself that particular position, you actually disarm the whole stress mechanism that is going on within you. So thank you very much, Dr. Luthra. This was an excellent points that you raised and also shared with us today with your experience. And I'm sure that people will get a lot more out of this, to take to
The
home.
other aspects of the stress management obviously will go on to, relationships, children's, spouse, and other situation that can be, but that could be for another day.
Thank you very much. I appreciate your time with us. Thank you.
Thank you so very much for having me.